Okay, day 4 real quick. I'm not going to do everything for day 4, but I want to show you a couple quick things, especially like how to cut the heart open when you get there. And make sure you follow the directions. Some of the things I'm going to show you are not till the end parts. A lot of the beginning stuff's pretty easy. But anyway, so here's the pig's heart. Talks about it being a mammal heart, and you know, all mammals have 4-chambered heart, and I'll show you real quickly. So this big, huge lower section here that you kind of think of, there's the heart. Those are actually called ventricles. There's 2 of them. You can't really see that there's 2 of them from the outside, but there's one on the right, one on the left, and then these little small structures here are called the atria, the atrium, and there's a right and left. So it's got 4 chambers: right atrium, right ventricle, left ventricle. And when you look at the heart, you always refer to the heart sides as if it was your own heart. So like if you're looking at this, obviously this is on your right side, but this is the pig's left side. So this is the left side of the heart. This is the right side of the heart. So you've got right ventricle, right atrium. They're going to ask you to look kind of to identify different, you know, major vessels, veins, and arteries that come into this. So you can actually see this one is coming up from the lower part of the body. It comes all the way up and it actually connects into the right atrium. That's called the vena cava. All the blood from the lower body ends up in that big vessel and it comes into the atrium. The atrium collects blood from the body, and then there's another one that comes from the, you can see it right here. Mine has a little bit of blue latex, which is cool because the blue is injected into the vein. So this is the superior vena cava. It comes from all the way in the upper body. Both of those go to the same place. And then, of course, you can see other, you know, this is big artery comes out, and then the aorta's in the middle. So anyway, you're looking for all those different arteries and veins. So then when you get around to removing the heart, I would try to cut it, find the veins and arteries and cut them, you know, so there's still a little bit of them attached to the heart. That way you can kind of see things a little better. So you're gonna remove the heart like that, and you can really then see all the major arteries that were coming out of the heart. The big one in the center that you can't see real well on mine is the aorta, and they talk about, this is really pretty cool. So this is the front of the heart. Again, it's sitting in the pig like this. This is the pulmonary artery, which goes to the lungs, which the blood doesn't have oxygen at that point. It goes to the lungs, gets oxygen, comes back to the left atrium, down to the left ventricle. Then it gets pumped out through the aorta, which is this right here. You can't see it real well. It's kind of, and the reason is because the pulmonary artery and the aorta are sort of fused together, because in an unborn mammal, the blood doesn't need to go to the lungs. So before the baby's born, the pulmonary artery and aorta are connected to each other. But as soon as it's born, it's kind of cool that it's called a shunt. The thing that connects the two sort of more or less disappears, and they become separated. So that way the blood that doesn't have oxygen goes to the lungs, comes back, goes to the, you know, eventually it goes to the left atrium, then left ventricle, pumps out to the body then, because it has blood after it's been to the lungs. So once you're born, you don't want those 2 arteries mixing like they were when you were a fetus. So lastly, again, you'll be finding other things, but when you cut the heart open, again, you have it sitting like this, just like it was in the pig, and then basically you want to start at the bottom, cut it right in half. So you have a front half and a back half. I'm sort of rushing a little bit here, but you can take your time. So you have front half of the heart, back half, and then you can just kind of open it up just like that, and then you'll be able to see the ventricles on the bottom, the atria on the top, and again find some different vessels and things. So that's pretty much it for that one.